Okay, I've got a couple items here. A deck of playing cards, some cloth tape, and then a little overwrap. And I don't know if you guys can figure what it is. Maybe by the title of the video you might have figured it out. But I've been wearing a CGM, just kind of a demo one for a period of time, last few days, and I wanted to share some of the data. You know, I'm on a carnivore diet, so some people are interested to see what happens when you're on a carnivore diet. And so, you know, basically this was kind of today's pattern up to today. You know, it starts overnight kind of, and I'm fairly low in the range, you know, in that little gray band there. It's between 60 and 120 is what I have it set. For some reason, the default settings are 70 to 180, which are the sort of the ADA recommended guidelines for diabetics, and their recommendations are atrocious. They're 70% of the time between 70 and 180, which means 30% of the time you can be above 180 or potentially below, which is not very good, particularly when we know these higher blood glucose levels over time are what leads to these complications. You know, things like kidney disease, you know, nephropathy, eye disease, or retinopathy, amputations, heart disease, so on and so forth. And so the fact that the American Diabetes Association continues to put out high carb recipes and do that when they know that very well most people are going to see significant spikes with this. And so, you know, we look at my information. You know, so in the morning I'm flat. I eat a bunch. Right now I'm doing one meal a day, so I eat. You know, it was you know almost 3 pounds of food, about 2.5 pounds of meat, and you know, well, actually only about 4 eggs today, and gentle rise afterwards. And then as I worked out, you know, a little bit later, a couple hours later, I saw like the biggest spike. I think I peaked at around 127 milligrams per deciliter. The bottom number was, the lowest I was probably in the 60s throughout the day. And if we look at like a 2-day average or a 48 average, you know, my average I think is something like 86 or 85. And I'm always in range, except I'm a little bit low. Sometimes I'm low, sometimes I'm below 70. A lot of time I spend a lot of time, you know, in the 60s is what I see typically. So that is, you know, and what is a CGM doing? It's not actually measuring your blood glucose, which is a sort of a misconception. What it measures is the glucose concentration in the intracellular interstitial fluid. And, you know, the numbers are often very close to what your blood glucose is. In fact, you can calibrate, and I calibrate it with a monitor, you know, like a regular finger stick monitor, beginning of the day, just to make sure how close they are, and you know if they're off. And usually, it's usually within 5, you know, 10 points is what I've seen. Typically, it's a lot of times it's right on the money. I've calibrated it a couple times now, and it lags your blood glucose by about, according to this one, about 5 to 10 minutes. This is the Dexcom 6 version, I guess. And so, what is the purpose of all this stuff? So anyway, when I go to jiu-jitsu, I've got it on my thigh, my upper thigh, and just for the record, it's not supposed to be valid for the thigh. It's supposed to be on your belly area, but I prefer putting it on the thigh just because I can protect it better, I think. So when I'm in jiu-jitsu, a lot of times people are smacking into your legs and your arms, and so what I do on the thighs, I actually cover it because it's a little monitor, it's a little sensor that you insert. You don't even feel any. I didn't feel anything. There's no pain at all involved in this. And then there's a little transmitter that sort of snaps in place over that. And that transmitter can be knocked loose or even broken if you're in, you know, with a lot of contact. And you know, usually when I'm in jiu-jitsu, particularly when I'm rolling, it's, you know, it's pretty hard charging stuff. And so what I use, I put a little playing card over the whole thing and kind of make so there's no way you can shear it off. It's just kind of this, kind of builds a ramp over it, and then I just tape it up and then overwrap it, tape it some more, and that's what that's for. So anyway, let me know if you guys have any experience with a CGM, whether diabetic or not. Let me know how a low carb or a carnivore diet has impacted your CGM tracings. You know, again, you know, I don't know that a perfectly flat CGM is what we want, if that's ideal or not. Probably, I would say very likely, it's better than having a super high fluctuating one. I think people, particularly diabetics, may want to chime in. When your blood glucose is up and down, you don't feel very good. You know, you feel either really sleepy or tired, you can't concentrate, or you feel hypoglycemic, where you're just, you know, sweating and heart's racing, and you just feel like you got to eat right away, or you feel really, really anxious when that occurs. And so, anyway, thought I'd share that with you guys. You guys have a great day. I gotta go to jiu-jitsu here in a few minutes. So take care, everybody. Bye bye.